My name is Dr. Hatem Soliman, and I'm one of the breast medical oncologists in the breast department at the Moffitt Cancer Center, and we're here at ASCO 2023 to present our exciting data from our investigator-initiated phase 2 trial using the oncolytic virus TVEC for the treatment of women with early-stage triple-negative breast cancer. And this presentation concerns research that we did into biomarkers from patient tissue samples that are associated with either a good response to the use of the virus or a poor response during treatment. And so initially what we were able to do was to analyze the landscape of the mutations found within the patient tumor samples. And as can be seen here, that there was a variety of different tumors that had a number of different alterations. Now, in trying to look at it, the pattern and figure out which genes were associated with a favorable response, we found here that the top 5 overexpressed genes were ones that were all associated with poor prognosis, more aggressive triple-negative breast cancer, such as SLC12A1, FGFR. These are all genes that we know are upregulated in triple-negative tumors that are highly proliferative, more aggressive, and have a poor prognosis. And so this means that in some cases we think the virus may be able to target these more biologically aggressive tumors effectively. The other interesting finding in our study was that in patients that had a specific alteration or mutation in the gene known as EIF2A, they were associated with a less likelihood of having a complete response to TVEC compared to those patients that did not have the mutation. And the interesting part about this finding is that this gene is involved in pathways that govern how the cells respond to viral infection, which could make sense in that if the cells are unable to mount a proper response when they're infected with TVEC, they may be less likely to rupture or die when they're injected with the tumor. So the hope of some of these analyses is that we can identify biomarkers that would be useful for future studies in using oncolytic viruses in the treatment of triple-negative breast cancer so that we can better tailor therapies and improve cure rates for our patients.